Hi, I'm Dr. Yuval Bibi. I'm a board-certified dermatologist, and I wanted to talk to you about lichen sclerosus in preteen girls. Now, that is a very controversial subject because lichen sclerosus is a condition that occurs mostly in adult women and adult men, but mostly in adult women, and it affects the privates in adult women. It appears as ivory white plaques on the privates. It can lead to severe disfigurement of the privates, and down the road, it can lead to skin cancer in certain cases. So it's a very serious condition in adult women, but what most people don't know is that this condition can actually appear in prepubescent or preteen age girls and can have severe ramifications for the girl's health. Now, the problem with lichen sclerosus is that in those age groups, it's not that well recognized. And what happens is that most of the time, the condition goes undiagnosed or misdiagnosed as urinary tract infections or as thrush or candidiasis infection with yeast of the privates, which is a much more common problem. Not that common in girls, but it can actually happen. And why is it recognized or misdiagnosed as thrush or candidiasis? Well, the reason is the condition appears as white plaques on the affected areas, and people can mistake those plaques for candidiasis. So candidiasis actually appears as milky discharge, white discharge, and sometimes that discharge can cake up and become plaquey over the areas that are affected. And candidiasis can certainly be associated with neurosensory symptoms like burning or itch or pain. And those are symptoms that can be very commonly associated with lichen sclerosus. But lichen sclerosus is quite a different condition. It is not an infection, for all we know. It is an idiopathic inflammatory condition, meaning the cause is not that clearly defined. But what the condition does is it does inflame the areas that it affects or attacks. And when it affects the privates, it can lead to atrophy of the parts that it affects, such as the labia minora and the introitus or the entrance to the vagina. It can actually affect the urinary tract and adjacent structures, meaning nearby structures. So it can lead to severe deformity, severe disability down the road. And that needs to be recognized very quickly and acted upon quickly with decision and with the right medications. So what happens in many cases is that these girls go undiagnosed or misdiagnosed and treated with anti-yeast medications or antibiotics for a while, and they're considered one of these resistant cases, meaning because the condition doesn't really respond as expected, because urinary tract infections or yeast infections should respond within a few days to appropriate treatment. This is a very unusual scenario where a urinary tract infection does not respond within 2 to 3 days of antibiotic treatment, or a yeast infection doesn't respond within a few days to antifungal treatment or anti-yeast medications. So those girls go undiagnosed for a while, sometimes for weeks and sometimes for months. In many cases, the damage is already done to the privates by the time they reach to a doctor that makes the diagnosis. So this diagnosis needs to be on the forefront of every parent's mind whose child has some genital itch that is persistent, that keeps on repeating itself, that keeps getting diagnosed as some sort of an infection, but doesn't quite respond in the way you'd expect an infection to respond, which is a few short days after implementation of antibiotic or antifungal medication. So what's there to be done? Well, the bottom line is that you need to know the time frame of response to each condition for the right treatment. If you're dealing with an infection, the treatment response should be within a few days in most cases. If it doesn't respond, this means that you need to investigate further, not just dismiss it as recurring infections or something that just doesn't quite fit into the right paradigm. This needs to be investigated. It needs to be investigated quickly and better done by a board-certified dermatologist that has expertise in the area, can diagnose the problem appropriately, actually treat with the right medication, which most of the time is topical steroids, and take care of business so your child does not incur further damage from this very, very serious condition. Now, there's another clue to the possibility of lichen sclerosus, and that's another condition called lichen striatus. Lichen striatus is a condition that appears as scaly plaques that show up in a line across a limb, down a limb, that follow what we call the Blaschkoid distribution. It follows certain types of lines that line up the limbs that are called Blaschko lines. And this condition can look like a snake of scale or a line of scaly area over the leg or the arm of the child. When this appears on your child's arm or leg, that is something that should indicate to you that the child's privates needs to be examined and lichen sclerosus needs to be ruled out to make sure that it's not affecting your child's health. So lichen striatus could be a clue that lichen sclerosus is a problem on the privates and may be a reason to go check it out with a dermatologist to make both diagnoses of lichen striatus and lichen sclerosus. If you found this video helpful, don't forget to smash that subscribe button. Also, don't forget to share and like this video for more information about how to take care of your skin in the most cost-effective way, not to mention how to take care of your child's skin. Pick up my book, 6 Skin, Skincare Made Simple on Amazon.com, now available in audio. Thanks for watching. God bless.